We are Monday, 23rd March 2020, and what a year it has been. What a few months it has been, and what a few days it has been. So much so that the government is now asking you rather nicely to stay indoors, and the government is also telling you not to go into pubs and clubs and restaurants and bars and so on. Pubs, clubs, restaurants, public spaces are told that they should now close. What do we have left? Well, we also have the NHS left, as well as the administration of justice left. What, pray tell, is left in the administration of justice? I should tell you that that is some courts and some trials and so on and so forth, because wherever possible, courtroom hearings or court hearings should now be taking place remotely, wherever possible, and so on. Do you think that that is far enough? Do you think that is not far enough? Do you think that the government should go into complete and absolute lockdown of the country? Because let's face it, ultimately, this is about protecting people's lives. And of course, the new catchline is protect the NHS. How can we protect the NHS if we're not going to protect lives? So today I have with me a very special guest, someone who has a ton of experience in the legal sector, specifically from the management side of the legal sector. And this is a very unique insight that our listeners are being provided today. I have with me Stephen Ward. Stephen, welcome to the show.
Hi, welcome. Thank you.
Stephen, tell us a little bit about you. I've said that you are someone who has got an enormous amount of experience in the legal field. How is it that that has happened?
Well, I became a barrister's clerk when I was 16, and so that was 35 years ago. So I've been working in the administration of justice for 35 years now.
Wow. What is a barrister's clerk for those who are unaware?
Well, that's the million-dollar question. All barristers in England and Wales are self-employed, and so they collectively get together to form a chambers, which is really just a collection of rooms where barristers work from, and jointly they employ staff, and the staff are commonly called clerks, and the clerks provide all of the usual services that you'd expect for somebody who is self-employed lawyer, which is things like diary management.
We didn't catch that last bit.
Sorry, all of the services that a self-employed lawyer would need are provided basically by the clerks and their team. Everything from HR, hiring and firing, through to diary management and agreeing fees for work and collecting those fees, getting the barrister to and from the right court at the right time on the right day.
I do think you are underplaying it a little, Stephen. As you know, I'm a barrister, and obviously, there is a connection between you and I. The barristers' clerks, your role is quite crucial when it comes to discussions with not just the courts, but also the solicitors, which ultimately is for the benefit also of the members of the public.
Yeah, I mean, I think you as a clerk, you have to be a very practical person, very solutions driven. You never quite know what the next phone call is going to be. You don't know what the next challenge is, and obviously that is where we are at the moment. Things are changing very, very fast.
Yes, you're not someone who is used to shying away from challenges of management and administration and ensuring things run smoothly. Tell us a bit about your chambers.
So our chambers are called Clerksroom. We're basically all of our barristers, we're reasonably unique. We have facilities in London and Manchester and Taunton in Somerset. But basically all of our barristers, we have 130 barristers, and they all work from home all around the UK. So in effect, we have 130 locations around England and Wales where our barristers can meet people and deliver our services. So it's a sort of remote home working basis, really.
When did that start? Because at this precise moment in time, the government advice is to work from home. So when did you start Clerksroom, and how is that fitting in? Is it fitting in with the current state of play today, or are there challenges?
Well, in terms of us operating as a business, this is what we've been doing for 18 years now. So, you know, I'm sat at home now with my screen and talking to you, and it really doesn't matter if you've got internet and a laptop or any device. We can operate chambers from anywhere. So, you know, to a certain extent, we haven't had to adapt. It's really what's adapting around us that's the problem.
I see. And from the news that you have heard and so on, no doubt you've been following the Prime Minister Boris Johnson's daily briefings and what have you, and of course those from the Ministry of Justice. What's happening with the court hearings at the moment? What can you tell us about that?
Well, the most recent advice, which was 7 o'clock this morning, is that only essential hearings not essential hearings are taking place, but only essential people who need to go to court are still being asked to attend. We don't do criminal law in our chambers, but the briefing this morning from Susan Ackland-Hood, who is the CEO of the HM Court Service, said that all vulnerable people were excused from jury service, which of course is completely sensible. But at the moment, hearings are still continuing, and the judges have all been issued with guidance to say if you can use reasonable ways of doing things online or video conferencing, that basically they're being given the authority to adapt as they need to, which is good to see, really.
See, my concern with the guidance in this regard is to the government advice that is being given, and government advice is stay at home unless it is absolutely necessary, keep 2 meters of distance and so on. And why is it that some of these court hearings are now being considered to be absolutely necessary?
Well, I think it's fair to say I don't know the answer to the question. All I do know is that, you know, we're all being asked to follow advice. The recent message from the court service was that obviously government and the rule of law are both considered to be pretty essential parts of our society. And
indeed.
And also, I think if you're in the middle of a particular criminal trial or something like that, then obviously it would cost an enormous amount of money to redo that. But I guess health comes first. You know, but I think everything is being monitored almost hourly at the moment. So who knows?
Yes. Now, it seems to me, and I wonder whether I can pose that to you as a question, that isn't the best way to go into an absolute complete lockdown, because over the weekend, we have seen lots and lots of people out and about on beaches and national parks and so on, because the weather was nice.
this is going to sound like I'm sort of copping out of the answer, but I think I have faith, believe it or not, in those with far greater knowledge. My view is to keep a steady hand on the tiller where you can of your business. To listen to all advice being given out, and if possible stay at home. I'm a member of a local volunteer group, so we're going out and collecting prescriptions and things at a safe distance.
Excellent.
Until such time as we are given further instruction, because I think it's the lack of it may appear to a lot of people that there's a lot of instruction coming down, but if you are in the community or trying to get in contact with your council or a service for a vulnerable person, there isn't a lot of information coming down. So it's actually strange from that point of view, but the guidance at the moment from the courts can be disseminated very, very quickly, and it appears to be working. So I think social media's got a really good part to play in all of this.
Well, social media does have a decent role to play in it, but I'm sure lots and lots of people are inundated with an absolute barrage of WhatsApp messages and what have you, which a great deal of which end up being as fake news and or myths, as it were. So do you think there's a lot of scaremongering going on? Or do you think people are rightly concerned that this is indeed a very serious respiratory illness, and people need to take every precaution?
Well, I don't subscribe to any of the rumours or anything. I'm a very practical person. As far as I'm concerned, we have a business and a role to play in the justice system.
Yes,
we have a role to play in our local community, and we're all individuals. You can only really do what you can do yourself. I'm fortunate that I have quite a wide network, be them suppliers or staff or even our barrister network. So when you're 150 strong like we are, you can get support and resources mobilized. So my view is we have to cope with whatever is in our inbox, is in our
you seem to have cut out for a brief moment.
Sorry.
I just heard that you can get support and you can get resources.
Yeah, so I think it's just a question of trying to do what we can with what we've got around us and how we can help in our communities and so on.
So speaking of how we can help in our communities, you have, as you said, you've started collecting prescriptions and what have you. And there are other things in the pipeline, aren't there, as I understand the position to be from your side of things, which you are taking a lead on?
Yeah, we basically what I looked at the government's announcement about a week ago now, with Boris Johnson standing on the steps of Downing Street and basically saying to the country, the community is going to have to step in and help each other. And I thought, I will look back at that statement and think, wow, I think it was obvious that things were going to get worse.
Yes.
And I think it was being made pretty obvious that community groups will need to rally together. And so my wife and I decided almost immediately at that point to start planning a website, because it's something that I'm involved in a lot of community work anyway, but we started to look at what was happening in terms of Facebook groups and all the local support groups, and everybody's in the same boat. Nobody has resources for community work or charities. I mean, I don't think there's any dispute about that. Everybody knows that that it's really hard out there.
Yes.
And it seemed to me that one of the obvious things that was going to need to be tackled very quickly was how do you provide resources to volunteers. So we've been planning over the last week, 7-8 days now, a national website which will be postcode driven, and allow people to either essentially register a need or a request for help, or obtain that help by putting them in touch with whichever local group is operating and able to provide the service.
So you've done that from your own back, as it were. One of the questions that springs to mind is, why should there be reliability on your independent group, as it were, as opposed to let's turn to the government's resources and so on and so forth and look at what the government guidance is. But I'm afraid I'm going to have to pick up on that particular question with you right after a few of these important messages, as we are now running short of time and are going straight into a commercial break. Welcome back, dear listeners. You are listening to me, commercial barrister Tahir Ashraf. What do I want you to do? I want you to keep it locked. I want you to keep listening. And I also want you to follow, yes, I do want you to follow government advice. That government advice is stay indoors, stay safe. Get in touch with others. Pass the message on. Tell them to stay indoors, stay safe. Protect yourselves, protect your loved ones, your families, and of course the NHS. Before the break, you were listening to a conversation between Stephen Ward and I. Stephen is someone who is thoroughly experienced in the administration of justice through the operation and running of a virtual set of chambers where barristers are independent and so on. And the question I had asked before the break is, Stephen, why should people turn to you and charitable offering now, as opposed to a government-driven, government-orientated website and so on and so forth? And I appreciate that I might even be anticipating part and parcel of the answer, and that part and parcel of the answer undoubtedly is, well, resources are already stretched, and obviously the NHS is already stretched. What's your answer to this question then, Stephen? Why should people turn to you or to your website?
I was going to say it's not me as such. What we're doing is connecting the thousands of volunteers who have stepped up and come forward locally. I mean, I think
so it's essentially a platform that you're providing, isn't it?
Yeah, we're putting together a platform which connects all of the voluntary groups and local groups and provides them with an easy way to retain details of who the volunteers are, to do the ID checks where it's needed. We just want to harness the support. I mean, the honest answer as to why should anybody be bothered or get involved is with what we're doing is because I just think, and it's only my view, that all of us can just do what we can. There are people in the government can only do so much, and they can only do it at a certain pace.
Yes.
I had a phone call this morning from an elderly lady who was in tears because her chemist had told her they couldn't deliver her prescription to her. They were overwhelmed. So my wife went straight out, collected the prescription with a few safeguarding bits of information, and delivered the prescription to her through the letterbox. At the end of the day, There are no rules at the moment. We're all struggling. All of the people that are providing administrative support to
Mm,
local groups are doing it with no government information. So
mm,
the most commonly asked question is how do you take payment from someone? Because clearly we don't want to be carrying cash, or we don't want money to change hands on
mm.
doorsteps, if possible, unless it's somebody you know. Um, and the situation is going to get worse. So, these problems need to be
Uh,
sorted, and it won't be me that answers them. It will be someone else, but we can disseminate that.
That's a very interesting point, actually, isn't it? Because lots of people have to pay for the medication and many don't. And therefore, the vast majority of the times, the system, as I understand the position to be at present, is such that when you attend, you pay. I think you may have just identified a need there for there to be the ability to be able to pay online in some way, shape, or form for medication.
Exactly, and I think chemists. We have 4 chemists in my local area,
Hmm.
and we've contacted all of them to say what facilities and what we're finding. I mean, really just sharing information about what we're learning. There's at the moment, as at now, there's 5,728 admin users for community groups on one group, and
Hmm.
they are all sharing the same issue about payment, um, and
Yeah.
what level of ID checks you have to do if someone volunteers.
Mm. Well, yes, because there are all sorts of safeguarding concerns when it comes to children and the elderly in particular.
Yeah, I mean,
And
we're not anticipating. I mean, the government has made it quite clear they're going to roll out services by the end of this week to the most vulnerable. So we're not in any way trying to provide a need for, the word vulnerable is an interesting one, because,
yes.
as you say, if there's what we're saying at the moment is the line that we're drawing is we won't exchange money.
Hmm.
And so you have to ring up and pay for the service, and we will provide a collection and delivery service.
Hmm.
We will not enter anybody's house, and we will not offer anybody a lift. So what we're trying to do is, if somebody has a medical appointment and needs to get to
Hmm.
a hospital or something,
Yes.
we will try to find that correct service, or find a neighbour
Wow.
who they know, to provide that service. Because we at the moment, we just feel common sense has to prevail, and everyone will have a different view about what that means. So it's
Mm.
at the moment we're being asked. We've had 3 requests this morning, personally, just my wife and I, to go and collect prescriptions for people
Hmm.
in town,
Yep.
and various shopping requests for people who are self-isolating. So those are the sorts of things that we can do immediately, and it's a question of how you coordinate that, really. One of the things that
Yes.
I'm particularly concerned about is just creating the audit trail.
Yes.
Which may sound a bit over the top, but if anything comes back to haunt us in a few months' time, and says, well, why did you ask that person to go there, and what did you know about them? Again, we're trying to apply common sense rules, because there is no guidance that we're aware of. I mean, I'm sure there's people out there that will say to you, well, of course there's guidance, but there's official local authority guidance for safeguarding and things, but that's not what we're talking about. We're talking about a good deed for a neighbour at the moment.
Yes, and that good deed is essential, as indeed is safety of your volunteer. Well, I say your volunteers, the volunteers of the UK. Just on that note, is it UK wide or is it just England and Wales at the moment that you're
Um,
coordinating, you're
I
helping?
don't know the answer to that exact question, because the map of available groups is all over the country, and groups are free to set up in any postcode. So as far as I am aware, it can be anywhere in the United Kingdom.
Mm-hmm. Okay. One of the questions I have for you is this. You mentioned earlier getting to a hospital appointment and so on. We are all being asked, obviously, to try and avoid public transport. Has that presented itself as an issue among some of your volunteer groups?
I've not seen it become an issue as yet. We haven't. I mean, I think it's very early days. And a lot of people have been, especially the elderly or anyone who's got a medical condition, has pretty much been in lockdown in any event since this started. So, I mean, for instance, my mother-in-law is meant to be in having chemotherapy tomorrow, but she can't find out from the hospital if that's proceeding. So, because the phone lines are chock-a-block. So it's the practical things about, if she is needed to go to hospital, how we get her there, and how that would work.
Yes.
And we don't know any of the answers at the moment.
And of course, as we know, that chemo is also likely to have a negative impact on the immune system, and therefore placing her at greater risk.
Yeah, it's just all very worrying time for anybody in that sort of situation, really.
Yes. Now, let's move on to something slightly different then. What sort of practical measures are you and your groups or people who are volunteering advocating anyone to take?
Well, I think again, following the advice is to stay 2 meters apart. We're saying to people, if you come into contact with, if you're touching at somebody's gate or touching anything, is obviously to do the usual hand washing or sanitize. But on a practical note, I mean, we're just taking the phone number of the person, arriving at their property and calling them and saying, I'm outside and I'm going to leave your prescription or this shopping on your doorstep, and so that you're on the right door, and that the person knows it's out there, and then you can step away, and then they can pick it up. It all seems very strange, but obviously very necessary.
Yes. Now, on the shopping for a number of people over the last certainly week and certainly a couple of weeks, because there had been reports of can't remember which countries, perhaps down under Australia or wherever it was, or New Zealand or whichever country it was, that there were people bulk buying in shopping trolleys, toilet paper and so on and so forth. And of course, restrictions have now. Many of the supermarkets are exercising some restrictions when it comes to shopping for the elderly, or certainly allowing, say, for example, the first hour of opening for it to be used for the elderly. And as I understand, the position to buy the elderly. Have you come across that?
Yeah, I mean, yes, we've come across it, and I think everybody is just in the same boat, really. The good thing about the group is that we've asked shops to let us know. One of the problems that we found early on was that 100 people were going into the chemist shop and asking if they had paracetamol.
Yes,
and the answer was no. And they didn't put a note on the door or anything because they're just overwhelmed in their shop. So what we were able to do is ask our local businesses and shops to keep us updated centrally about what, a lot of pubs and restaurants have closed for, obviously they've all closed for eating in, but
yes.
but a lot of them have immediately turned into takeaways and deliveries. So we're able to maintain the list of the local services that are operating and providing a service. And that includes, when Boots or whatever gets a delivery of Calpol and people that need it, because Calpol seems to be a strange thing that's people are running out of. So we're just able to coordinate that, really. I think we're all in the same boat in terms of the availability, but we haven't seen any. There seems to be enough. It's just very worrying.
Yes, I think panic buying has led to many people just panic buying even medicines and toiletries and all sorts. So the centralized system that you're creating, is that something that you're thinking for future purposes? I say future because every day, every hour, as you say, is evolving. The situation continues to evolve. Is there a way, or have you and people with whom you're working to get this operational considered passing this on to the government or liaising with some of the larger retailers?
Well,
or is it just
yes.
local shops at the moment?
Well, it's everybody at the moment. Local shops. We get a daily update from the supermarkets, all of them, and bizarrely, the requests are coming in for staff. So we're sharing information about, there's people out there that have been laid off and not working.
Sorry, the supermarkets, is that specifically in your area or is that nationally?
Well, I can't speak for nationally, but I know that most supermarkets are looking for staff,
right.
Certainly in our area, and I think they are national flyers that are going out. But that wasn't what we were expecting. But obviously, it's information that we can share in our community anyway. We know if I live in a rural place down in Somerset, and we have farms that need people to help with the crops because the people that would normally help are not available at the moment. So there is different things changing, sort of. But the idea really that we're keeping a real focus on throughout this, one of the positives I think about all this is first of all what a great community spirit we have. And I hope that's everywhere.
Yes.
And secondly, that we're keeping a very close eye on what lessons are we learning and what can we take to go forwards, because volunteering and community work has always taken a back seat, or I'm not qualified to talk about that, so I'm not giving a fact or anything, but it seems to me that a lot of community groups are underfunded.
But I think that's a very good note on which, that's a very good note on which for us to go into the next commercial break, because it is essentially all about lessons, because we haven't as a country, in my view, learnt lessons from other nations. But let's explore the lessons in a few moments' time, right after this commercial break. Welcome back, dear listeners. You're listening to me, commercial barrister Tahir Ashraf, presenting Drive Time on Monday, the 23rd of March 2020. Before the break, you were listening to me having a conversation with Stephen Ward. Stephen is the managing director of Clerksroom, which is a Barristers Chambers, which operates nationally throughout the country. But the unique thing about this particular set of Barristers Chambers is, of course, that each of the barristers, 130 odd, are dotted around across the entire length and breadth of the country. That is what makes it unique, because the administration of justice, as Stephen says, as indeed the Prime Minister and the government have said, must continue and continues. So, welcome back, Stephen.
Hi.
So before the break, we were talking about lessons learnt, and obviously the volunteer group platform that you have created and are working on to provide for the community. Everyone is learning lessons from that, and indeed, one would hope from other countries. Speaking of lessons from other countries, China went into a absolute complete lockdown and shutdown. Do you think we should have gone into a complete lockdown and shutdown sooner? to save lives, or do you think we are doing things the right way? And I appreciate I'm putting you on the spot.
Well, you are putting me on the spot, and I just don't think I'm qualified to know the answer to that question. I think what's been very interesting about the emergency, and I don't think the words are too strong, is the way that the government have put the messages out. I think the government has to have its plan, but you've got to make sure you don't create panic. And I think we've all been in this together for about 10 days now. I think a lot of people weren't taking it very seriously at the outset. And if the government had just come out and said, right, lockdown, nobody would have had time to prepare.
Right.
I mean, it's taken a lot of companies, whether it be a matter of days or a week, to adapt to getting people to work from home and so on. And obviously, there's awful difficulties with people who aren't able to do that. So, it's difficult all round, and I think it's very, very difficult to have any blame at the moment anywhere. We've all just got to get on and do what we can.
Sure, forgive me. I hadn't meant it in terms of blame per se, because blame is very strong, because ultimately, it's a virus. It's as simple as that. One way or another, everyone in the country is more than likely to be able to catch it. It's simply a matter of timing, because as with the flu virus and so on, most people catch the virus. Some people end up with severe symptoms, some people with less so. So I hadn't meant it in a blame game sense, but what I had meant it was that, do you think it's a good idea? It's an interesting point that you raised, that we wouldn't have had enough time for prep. Well, now that we are, shall we say, approaching lockdown, we are told from the government there is enough food and so on and so forth in the supply chain. What do you say to people who are stockpiling and who have done, to the detriment of many others?
It's a difficult topic, because we are where we are.
Yeah.
I think when you take a phone call from an elderly person who is in tears and doesn't have a local support network, doesn't have family, doesn't have much contact with their neighbours, it from my point of view, it just puts it all into perspective. And at the end of the day, none of us can do more than a small token gesture. If you happen to have a spare package of something that somebody else is in need of, you can give it to them. But then obviously it is just a question of, I think, trying not to panic, but that's a very, very easy thing to say and not to do. It's human nature.
Yes. It's particularly troubling when it's an elderly person who is obviously in the vulnerable category. Tell me, are you doing, is the group, is the platform in some way, shape or form providing guidance when it comes to mental health? Because that's ultimately going to be, what's the word, thoroughly tried at this stage.
Well, we're not currently doing that. We're very much in the just getting it out in its most basic format, to allow for someone to request help in a way that is safe, and for someone to offer themselves to help, and to check who they are, so and audit that trail. But I think you're quite right. It will rapidly move to needing to signpost people to the relevant services. And again, it's out of my area of expertise, but as and when we're seeing the thing with the group is we've got 5,728 administrators at the moment on the group. And what we're able to do is see what those needs are, because they're not ones that we potentially.
Sorry, it cut out there for a moment. Sorry, Stephen, it cut out there for a moment. You've said 5,700 and
5,728 administrators working in the local groups. And what we're able to do quickly and easily is identify trends or problems arising, because obviously we're all facing the same issues. So I think you're quite right that I think mental health will become a more important issue, if it's not already, very rapidly. And yes, whatever we can do to circulate the right information from the right people at the right time can only be positive, I hope.
Yes, it's definitely about doing things at the right time and so on. Tell me this then, Stephen, on to something slight. How are you coping? How is your coping with the lockdown, shall we say?
Well, as I said sort of at the beginning, really, we as a business operate perfectly normally from home or mobile or from mobile devices. So apart from the rather strange turn of events and refocusing what we're doing, we're coping okay at the moment. But I'm just aware there are people a lot worse off than us, and that's our focus for the time being.
Yes. What about practical steps? Are you still getting up at the same time in the morning, and are you getting dressed and so on and so forth, and or are you functioning in your gym jams, as it were?
Well, there's been a lot of articles about that recently, and I personally find I have to get up at a particular time. I get up, I have my coffee, I have a shower, I have a shave, and I come down and then go through my sort of routine of going, because I think if you don't have the structure, it's very difficult. I mean, my wife and I have sort of promised ourselves that we will have a to-do list of things that we want to get done, like a bit of weeding or something, even if it's half an hour, to just stop what you're doing. Otherwise, you suddenly find it's 10 o'clock at night and you're still on the group looking at requests, and obviously that's not going to be healthy in the long term.
Yes, because as I understand the position to be, and certainly based on the Prime Minister's speeches, it was a case of, on Friday we are now telling pubs, clubs, restaurants, etc., public places of such ilk to close tonight, and we are telling them not to open tomorrow. And in the same breath, he said that we are expecting to be at the other end of this thing within 12 weeks. And we'll obviously monitor this situation on a month-by-month basis, but we're expecting to be at the other end of it within 12 weeks. So insofar as coping strategies and so on and so forth are concerned, to my own mind, it's extremely helpful for there to be structure. And I think you're absolutely right when it comes to saying that keeping it the way in which you and your wife are doing so will help prevent burnout. Are there any strategies that you can suggest, or is there anything that you can tell our listeners to do in terms of practical steps and to prevent burnout?
I think it's very difficult to give any specific guidance on that, because I think everybody's lives are so different. There will be people with children or elderly parents in the home or whatever, and of course your structure and your routine and everything has changed now. But from my point of view, I'm only applying common sense, nothing formal, but just having a bit of structure, understanding it may sound very stupid, but keeping an eye on the time, because if you get up in the morning and you're working through emails and requests and being bombarded as an admin user of a group, you suddenly realize that so much time has passed and it's 3 o'clock in the afternoon and you haven't had lunch or something. So
yes,
whatever anybody's priority is, it seems to me just sensible to actually stop and think about yourself and make sure you look after yourself first, because you're no good to anybody if you're not looking after yourself. So in a strange way, look after yourself as a lot of sort of business trainers and sportsmen and whatever. It's crucial that people look after themselves as best as they can, whatever that means.
I have little alternative but to agree with that advice, that suggestion, because even when one looks at whenever we're traveling abroad on aeroplanes and what have you, and in this abroad on aeroplanes, despite which the advice every single time is watch the security videos, look at the air hosts and air hostesses and what have you, stewards and what have you, and listen to what they're saying. And when they say put on your own mask first and then help others, even if there are children next to you, you're no good to anyone else if you're not helping your own self. That is, I'm afraid, all that we have got time for. But before we go off air, are you in a position to be able to share with us the name or the domain name and so on at this stage of the website and the groups?
We're not really in a position to do that at this stage, because we would be sharing a domain that if you go to it doesn't exist. So I don't think that's particularly helpful. But if people Google COVID-19 mutual aid, the website, the official website, I don't know how official it is, but the website with links to all the local groups is there. COVID-19 mutualaid.gov.uk, and there is a map on that site, and the tools that we will be rolling out very soon will enable all of those groups and the 5,728 admin users and the hundreds of thousands of volunteers who are now registered to operate and get requests for help and volunteers mobilized, hopefully a little bit easier than is currently the situation with limited tools and resources.
Okay, on that note, I'm afraid I've run out of time, and I'm going to take this opportunity to say thank you very much, Stephen.
That's okay. It was lovely to talk to you.
And thank you for helping. And of course, the country and history will remember this work of everyone. So,
that's right.
Thank you once again for taking a lead on this. I'm very grateful for you taking the time to speak to us and our listeners. That's it from me, I'm afraid. You are listening to me, commercial barrister Tahir Ashraf. Until next time.